Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal-Sentinel.
WisconsinEye coverage of the 2018 elections continues with the Brown County Library in Green Bay. Diana Lawrence of Appleton is a Democratic candidate in the 56th Assembly District. Diana, welcome to WisconsinEye.
Oh, thank you.
What do you perceive as the top issue in this in your district?
Oh, in my district? Well, probably like everywhere else, people are talking about Foxconn, even up there. So, you know, with what's happening to the properties down there. So I would say that's probably the number one thing people are talking about, besides politicians being crooks. I hear that a lot.
You do?
I do.
Let's talk about Foxconn first. Total state and local tax incentives or investments of more than $4 billion. Bad deal for the state?
Yes.
Why?
Yes, because that money could have been better spent elsewhere. Years ago, Scott Walker decided that stem cell research was not to be in Wisconsin. That could have been our Silicon Valley. We were among the leaders, and we let that go. And then when Foxconn came around, he felt maybe he needed to redeem himself because maybe the employment numbers weren't quite where they should be, the income levels aren't quite where they should be. And I just think we could have spent that money elsewhere in transportation or education, and made a bigger impact on the lives of the citizens of the state.
You mentioned transportation, the impasse in the capital over how to fund highways.
Mm-hmm.
How would you fund highways? Gas tax, registration fee, tolling, none of the above, all the above?
Yeah, I don't know. It's a real pickle because, you know, you don't want to be regressive about it. And I mean, I don't want to be regressive about it. And I know other states are struggling with it too. Like Oregon and California and some others have tried the mileage, and they're struggling with how to do it, how to actually get it to work out. So, I mean, I don't, quite frankly, I don't have an answer right now. I have to talk to some other experts, but I think other states are also having the same trouble.
And the issue of tolling comes up a lot in the capital. How do you feel just generically about tolling?
I don't like it, and I don't really, I think it's putting money into essentially private hands. Private companies who are going to control how the roads get used and that kind of thing. Plus, it's just a massive amount of infrastructure that has to go into place before it even takes off the ground. And again, that money could be better spent maybe on the roads themselves.
So when you knock on doors, you hear Foxconn and politicians are crooks.
Right.
How do you answer the second concern? Politicians are crooks. You're not in office now, so how do you respond?
Right. Well, you know, I mean, and sometimes the door closes pretty fast after that. So you don't often get, you know, a follow-up with that. But you find out that they just don't like the way the money is spent. And they feel used, you know, like others are getting more than they are getting. And I think when you feel that way, that's a hard bridge to cross, but it's one that I want to try and cross as when I get elected.
Do you want to change state spending priorities?
Well, yeah, I mean, I guess, because we have stopped really funding schools to the point that they should be.
That was one of my questions. Do our K-12 public schools need more money?
Yes. Well, and yes, and it probably needs to be better spent. And the funding formula is so complicated for that. I think we need to look at alternate funding, like a different funding system, get it off the property taxes. There's other ways to do it. I know other states are looking at it and have done it. So that's going to be one of my big learning opportunities, is how other states have done it successfully.
Would you shift what the portion of property taxes that now go to public schools? Would you raise other state taxes? If so, which ones to make up for that school aid?
And this is where I also need my own education, Steve, on this, because it is such a complicated issue. I am going to be talking to other experts around the area about how to, what would be the best way to go about that.
The choice and voucher program have grown dramatically. Started out in Milwaukee, Racine, now statewide. What's your position on the choice programs?
I don't like choice programs. I think they are, like the mantra you often hear, taxpayer-funded private schools. And I think, again, because when those students decide to come back, if they decide to come back, that money doesn't come back with them. It stays in the choice school. And I just think that's overall money better spent in the public school system.
School districts and local governments have been under levy limits since about 2006. Some local officials say, and this is their term, that levy limits are strangling their ability to provide local services. Should levy limits be eased, or should they be done away with?
Probably done away with. I mean, because if you have a slow-growing community, then you're going to have trouble funding your basic services because those dollars keep going up in cost. And if you have a fast-growing community, great, because it's based on, how fast your community is growing.
Yeah, your actual growth.
Yeah. But if you're stagnant, you're going to be in trouble.
So when you knock on doors, you hear about Foxconn and politicians are crooks, but I also bet you hear about health care. What questions or what concerns are you hearing from residents of what would be your district?
Well, it's kind of often related more to the Affordable Care Act. People are very concerned about that, and that's hard to talk to because it's a federal thing. But they're just always concerned about the cost of health care and if they're going to lose it.
Do you think the ultimate answer is some national universal health care system?
I do. And the one idea could be Medicare for all, that everyone has a basic start, and then you can maybe buy up from there. But then if everyone has basic, you have less, even people on Medicaid, they're very expensive on Medicaid. And if you had a Medicare for all type situation, people would not be going to emergency rooms and not have insurance, and that's very expensive for the rest of us. My own personal health care through my husband's employer goes up when more and more people go uninsured to the hospital and get services.
Rural areas have unique health care issues. They have older residents, and the young unfortunately leave. Household income can be lower than the state average, and more health care in rural areas comes from Medicare and Medicaid. Any thoughts on how to address the unique problems of rural health care?
Yeah, because they have so far to go to get any services at all, and physicians are no longer independent people in their profession. Physicians are basically employees of the healthcare systems they work for. So if the healthcare system isn't out in rural counties, in rural areas, then the rural people don't get any benefits from that. So I'm thinking getting like first-year doctors or even just any doctor who would want to go out to that area, set up a practice, get some sort of government support for doing it, and then that's probably the best way to do it, is to get it out there.
Excuse me. Some areas are reporting shortages of medical professionals. Do you think the state, what is the obligation of the state to provide any incentives to retain and recruit medical professionals in those areas?
Well, I do think that the state could, well, the government is to help people in my mind. That's what government should be doing, is to help their citizenry have a better life. And if part of that means you spend money to get health care out in the rural area, then you have to look at doing that, and maybe your taxes do go up. But if you have a better mix of spending, then you can accommodate that.
Against the backdrop of mass shootings and school shootings, do we need to change gun laws?
That's a hot button. Yes, I do think that some sort of registration and possibly insurance would, now that's a real pretty radical thought, having insurance on your weapon, because when you have that kind of responsibility, financial responsibility, are you more likely to know where that weapon is, lock it up, possibly, and it's easier to find the weapons in the case of a shooter if everything is registered.
An issue is background checks, 48-hour waiting period, raising the age to buy a weapon. Have you taken a position in any of those three?
Yep. Waiting periods should be longer. 48 hours is, I mean, really, if you can't wait 4 days or 5 days to get a weapon, then I wonder about what you want to use it for. So yes, I would think that having an additional waiting period would be better.
UW system funding, there's been a freeze on resident undergrad tuition for 6 years. Should the freeze continue for a 7th and 8th year?
No, I think it's hurting the UW system completely. And here you go again with the funding for the whole UW system in the first place. When I went to college in the 80s, I had a total bill of, of course I had a couple Pell Grants, but I had a total bill of $3,500. I mean, I think the students of today should have that opportunity to get an education and not break the bank for them. As a real estate agent, I saw people who weren't able to buy their first house, a simple house, because they had so much student loan debt. So yeah, I think stop the freeze and fund it better.
Should students with debt be able to refinance that?
Yes, I think you should. Yep.
Okay.
Yep.
A big issue in the next budget is going to be prisons, where there are plans to close the juvenile prisons. The Green Bay and Waupun prison were built in the 1800s. Do we need a new state prison?
Yes. I mean, we need to bring it up to modern code. I mean, at some point it becomes a dungeon, and you don't want people to live in something like that. I mean, you have to have modern facilities, but I don't think they should be private. I don't like the idea of privately run facilities.
Do you have a position on either medical marijuana or legalizing recreational marijuana?
Well, I can certainly see medical marijuana. I'm still kind of a little hesitant on the recreational marijuana. But I think, because people always think marijuana is the gateway drug. What I think is actually the gateway drug is a cigarette, because that is very addicting and it's very expensive. And I think, people move from that to other drugs very easily.
Have you thought about whether we should raise the state tax on cigarettes?
Yes, go. Just whatever you can do to get people off of it would be the best.
A number of bills have passed in the last 4 years dealing with the opioid, methamphetamine, and heroin addiction problem. Mm-hmm. Any thought on the next steps to curb that epidemic?
Yes. Actually, I do think that if you could, often one leads to a more serious, like maybe you start out with painkillers, and that leads to a more serious addiction with heroin and possibly death. That's a very dangerous drug. If you could support people who have the addiction already to the lesser of the opioids, then hopefully you can keep them from going on to the harder heroin drugs and reduce the death rate.
2 final questions. Number one, you want to highlight differences between you and your opponent in the August 14th primary?
Yes, having run for the state assembly in the past, back in 2012, I have experience doing that, and I also have experience in citizen lobbying. So I was public hearings, speaking to my legislators, speaking to Congress people, so I kind of know what that's like. And I think my customer service background, people wouldn't normally think of that as being an advantage, but it was in the healthcare background industry, and I heard a lot of stories from a lot of people. People don't call when they're happy, they call when there's a problem. And I've learned a lot about the healthcare industry based on people's problems based on those calls.
And a follow-up question, did you lobby on healthcare issues or other issues?
Mostly environmental.
Environmental.
With Sierra Club and Wisconsin League of Conservation Voters.
And you lobbied on what issues and for what positions?
A lot of mining issues and water issues.
No mining or stricter rules and regs over mining?
No mining.
No mining.
Mm-hmm.
Why?
Well, because we haven't got proof that they can operate a clean mine and have a mine that doesn't have problems down 20, 30, 40 years down the road. So okay.
No, excuse me. The final question is, you say on your website, I know I can do a better job, the incumbent Representative Murphy. What issues, what specific issues do you disagree with the incumbent on?
Just about everything.
Everything,
Which,
including many of these we've been talking about.
right, yep.
But is there
I
one?
I just think overall, I would say how we spend the money in this state is just misaligned with what is best for the citizens now and the citizens in the future.
Okay, thank you. Diana Lawrence of Appleton is a Democrat running in the August 14th primary in the 56th Assembly District. Diana, thank you for talking to WisconsinEye.
Thank you.
Thanks.